All right, all right, all right. Good afternoon, good afternoon. All right, we got a good brother with us today. We are going to talk. We're going to, uh-oh, hang on. I gotta, I gotta cut something out on my end. There you go. All right, we got Michael Scott with us today. We're going to talk about Black health and equity. To give an intro, Michael Scott serves as the Senior Program Manager at the Center for Black Health and Equity. He's been with the center since October 2015 and currently oversees tobacco and cancer prevention and education programming. He has 20 years of public health experience on the national, state, and local levels, and his work has focused on disease prevention in the areas of HIV, diabetes, cancer, and tobacco use prevention. Prior to his position at the center, he served as a health education specialist at both the Durham County Department of Public Health and Duke University Medical Center. He holds a Bachelor's of Science degree in health education from North Carolina Central University and is a certified health education specialist. With Michael, I have my always able brother Takuma Roback, our editor-in-chief, and we're gonna hop on in. So Michael, welcome, man.
Thank you. Thanks for having me.
Why don't you start by telling our audience about the wonderful work that you all are doing, man? I know you and I got a chance to chop it up on some different activities and some things related to tobacco-free Florida, and us talking about just a lot going on with tobacco use and even new use of new devices and things of that nature that are challenges for our community. So, but I know the center is doing so much beyond just tobacco prevention and education now. So yeah, give them a rundown, and we'll jump on in a little bit more.
Certainly. So again, thanks for having me. And yes, so we are the Center for Black Health and Equity. And as you mentioned, I oversee our tobacco and cancer prevention work. And the organization itself has been in existence for just a little over 20 years now. And we started out as the National African American Tobacco Prevention Network, NAPTN. And we strictly did work in tobacco prevention and then some cancer stuff. And, it was right in the name, Tobacco Prevention Network. But as we grew as an organization, by the time I came on board, we were already expanding our work into HIV specifically. So at the time when I came on board, tobacco, cancer, and HIV were our main focuses. And again, like you said, 6 years. Now I've been with the organization 6 years. We've gone from a staff of 5, 6 folks to well over 20 right now. And our efforts have expanded exponentially as well. So again, we're still doing tobacco and cancer, still doing HIV, but now we've expanded into food insecurity, women's health with a focus on fibroids. You can't be a public health organization and not do something with COVID-19.
Yep.
And equity centered policies. And really, when we say equity centered policies, I mean that covers the gamut, because when you look at all the health inequities that African Americans are experiencing, I mean, almost all of them can get traced back to some sort of policy or some sort of, behavior within the system that has resulted in these health inequities, which takes me back to the name change. So I said, we were initially we were NAPTN, and once our efforts expanded beyond just tobacco, we had to change the name of the organization. And the Center for Black Health and Equity is the name that we came up with, and really it couldn't be a more perfect name, because that's exactly what the organization is about: Black health and equity. Equity in the sense of health, but equity in the sense of Black folks being equal health wise in every aspect of life. So again, and then that touches on that equitable policy piece. But when you look at the mission of the organization, is to facilitate programs that are going to promote health and equity in African American communities in the United States. And we do that with a focus on community. So building community capacity, developing community infrastructure, advocating for those policies that are centered in equity. And all of this work is centered on and focused on the community model, which is the really the theoretical framework that all of our work is based on, which really talks about the community being the number one asset and the number one player in really moving that needle when we talk about health equity in African American communities.
And Michael, you all do a lot of training also, right? I mean, you all, I know in your work, you all are often moving throughout the nation and beyond doing training. Talk a little bit about that, because I know you all can assist organizations in making sure that they're aware of the work that you're doing and strengthening their own internal organization so they can, pass this information along to communities, in their area.
Mm-hmm, sure. And first I'll touch on like the training that I do specifically around tobacco work. So that's my wheelhouse. That's where my specialty lies, is in the tobacco work, the menthol flavored work. So the trainings that we do around tobacco and menthol include, what we call our tobacco 101 training, which gives folks a history of the relationship between African Americans, tobacco use, the introduction of menthol, and how that menthol flavored tobacco then just took over as far as what African Americans choose as their product of choice when smoking cigarettes. And then as a result, how those smoking behaviors impact health. Of course, lung cancer, but there's so many other disease conditions that are impacted by tobacco use, by smoking. Like we look at the top 5 or 6 causes of preventable death, all are tobacco related. You may not see tobacco, you may not see lung cancers up there or cancers up there, but some of these other things like diabetes and strokes, that a lot of folks, lay folks that aren't in public health or medically trained, don't really realize that smoking plays a major role in those as well. So we do a lot of training on that. We do training on just specifically on menthol and menthol's impact, the targeted marketing, and the insidious nature behind how menthol became the leading cigarette smoked by Black smokers. And it's really, again, the word insidious really doesn't describe it enough. And just in how it became the quote unquote Black cigarette. But as far as other trainings, we offer trainings on our health justice guide. So we actually just got off of a training call on our health justice guide. This is a guide that we've been working on for a couple of years now. That is just a comprehensive wealth of knowledge and training and calls to action based in tobacco work, but transferable to really any topic. And again, it goes back to that community model where we take folks through this training, and the whole idea, the whole end goal is that this training provides communities the tools, the capacity, the infrastructure to fight for change themselves. So we're not coming in, or we're not suggesting that other organizations come in and do the work for them. We're training them to do the work, to go in front of the decision makers, to research the data, their local community data, and have the real facts, the truth, to then go in front of, again, those decision makers. In the case of tobacco, menthol restrictions or smoke-free air, to go in front of these decision makers prepared to say why their community needs these changes, needs these rules put in place, needs these protections put in place, and the equitable focus that it has. And trainings, we've got our truth check training. Our truth check training is truthcheck.org is a training that, you know, it doesn't really, it's not about changing people's minds or opinions as far as social media and the information that they take in, but it's more about having folks realize how to identify misinformation, disinformation, especially in this climate we're in right now, social media, and you know where people get their information. You know, oh, I saw it on Facebook. You
A
know,
lot of misinformation out there, that's for sure.
oh, for sure, for sure. And I mean, we saw that heavily with COVID-19 and vaccines, but I mean, it's across the board, you know, with misinformation and disinformation that can impact your life, the life of your family, the life of your loved ones. So this training is about helping folks to identify misinformation, disinformation, you know, before that they then either act on it or share it with someone else. And those are just off the top some of the trainings that we offer. And again, we have, you know, our food insecurity, our women's health, and those are, you know, programs that I'm outside of, but I know that we've done trainings. We've done fibroid trainings. Actually, I sat in on one of those conversations with the fibroid discussion, and I mean,
A lot
there's
of
so
women
much.
are impacted, man. A
Oh
lot of
yeah,
women are impacted by fibroids.
Absolutely.
a lot of African American women.
Absolutely.
Yeah, a lot, yeah.
Michael, I don't want to, sorry to cut you off.
Oh, no,
Because
go ahead.
No,
go
go
ahead.
ahead.
you know, you had mentioned your wheelhouse, and I'm a baseball fanatic. So I want to give you a fastball here,
Okay.
right down the middle, regarding this conversation around menthol use in the Black community. Because they're going to be a population of people who are watching this who are saying to themselves, look, I don't smoke. I know intellectually what the dangers are, so I stay away from it. I've seen the commercials, et cetera, et cetera, et cetera. But for people who are in that category, can you kind of illustrate how pervasive this issue is with menthol cigarettes and the African American community?
Sure, sure. So when we look at African American smokers, 85%, close to 90% of all African American folks that smoke menthol. Okay. Okay, what's the big deal with menthol? Well, that's I mean, we could have this conversation. We could take this whole conversation and talk about menthol, but the bare bones of it is menthol makes it easier to start smoking. It reduces the harshness of the tobacco, and there's a relationship between the nicotine addiction and the menthol content, which means menthol makes it harder to quit because the addiction is a little bit stronger to the nicotine. Okay. And when we talk about, so I said 85-90% of African Americans are smoking menthols. Well, African American smokers smoke menthols. When we look at the general population, it's still about 1/3 of the general population that smokes menthol. And I have, menthol is a flavor. Okay. It's not part of the tobacco plant. It's a flavor additive. And we know that flavor additives in tobacco products is what attracts younger smokers. 2009, so 13 years ago, all flavors were taken out of cigarettes by law. The Family Smoking and Prevention Act. All flavors were taken out of cigarettes. So if you recall, yeah, right.
Right.
Except menthol. So back then, back in the day, there were, you know, different flavored cigarettes, the little BDs, you know, all kinds of flavors. You know, maybe it was maybe some of them were niche products, but there were still flavors, and they were still used by the industry to initiate smoking in youth. So the whole idea of the Family Smoking and Protection Act was to prevent youth initiation and increase cessation, increase people wanting to quit. So I'm going to take it back to that equitable policy discussion. With menthol being left off the plate in that law, now there's a whole group of folks who did not receive that same level of protection.
Mhm.
So the folks that were using menthol, they were still initiating smoking with menthol. They were still able to get their flavored menthol cigarettes. Youth were still able to get menthol to initiate the smoking. And it wasn't a mistake. It was by design that they did this, that Big Tobacco forced the issue. Hey, we're not going to move forward with this flavor ban if you don't take menthol out. So when that happened, of course, there was organizations such as us, the African American Tobacco Control Leadership Council. They were like, well, wait a minute, ho, 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 ho. Where's the concern, the level of protection for the menthol smokers who are overwhelmingly African American, who are overwhelmingly members of other priority populations that are disproportionately impacted, women, LGBT, Asians, people with lower socioeconomic status? All these folks smoke menthols at higher rates. All these folks then are being more disproportionately impacted by the use. So it's been 13 years now, but now we're finally seeing some movement at least. So for folks that are watching this and are not aware, the FDA has finally moved forward with banning menthol in cigarettes and banning flavored little cigars. So like Black and Milds, Swisher Sweets.
Mhm.
Eventually those products are going to be off the market. We don't know how long it's going to take, but that's in process right now. There's some exceptions to the rule that unfortunately are there that we're hoping to, when it's finally said and done, is included. So menthol is still going to be available in the e-products. Premium cigars are exempt. So, we're talking little cigars, cigarillos, but like, the nice big fat cigars that you get at the specialty shops, those are exempt for now. And then menthol itself, menthol as a flavor, as a characterizing flavor, is what's being banned. But menthol is actually an ingredient in pretty much every tobacco product, whether we're talking about cigars, cigarettes, chew, spit, dip tobacco. There's a little menthol in almost every tobacco product because, again, going back to what it is about menthol, it takes the harshness away,
Mhm.
and it gives a little bit of flavor, so it makes it a little more attractive to the user, to the taste buds. So it's being banned as a characterizing flavor, but not as an ingredient. So it's still going to be in there, but just not as a characterizing flavor. How much of it makes a characterizing flavor? They haven't said. So that's one of the things that us in public health are pushing for. Like, you got to tell us what amount makes it a characterizing flavor. Because if you're taking out the flavor, just take it out completely. All the other flavors were taken out completely, but Big Tobacco knows that menthol,
Big seller.
menthol makes it, one of my colleagues who's a titan in the world of tobacco prevention, Dr. Phil Gardner, this is his quote, is that menthol, it helps the poison go down easier.
Wow. You talked about, the insidious nature of it, in the sense of marketing. Excuse me. And targeting. Can you talk a little bit about that?
Sure. So, we look back, 50, 60 years, 70 years ago, and, African Americans were smoking, but they weren't smoking menthols any more than anybody else. They were smoking menthols at about a rate of like 5%, which was just slightly higher than the overall population. So, with that slight preference, and Big Tobacco, their marketing machine, their research arm is just incredible at what they do, and the money behind them enables them to do all this. They noticed that slight preference of
Mhm.
menthol and ran with it,
Double down.
began promoting menthol products in African American communities. I think all of us are probably of that age. We remember the free sampling vans.
Yeah, you hear that? He
Talked
said
about that.
the
Yeah.
free sampling vans, like in
And
the
Yeah.
community,
yeah.
samples.
In the Black community.
Yeah.
You'd be hard pressed to see that in other communities.
Right.
Poor low income communities, sure. And if we think back to the after school specials about drugs, and it was always, here's the first sample is free,
Mm.
and you look at tobacco, they pull up in their truck and they're handing out packs of free cigarettes. This one's free, this one's on us. Boom. Now you got a whole community, addicted to tobacco. And then in African American communities and low income communities, you're seeing way more tobacco retailers. You're seeing way more ads in the stores. You can't even see inside the store for all
Right.
the ads for menthol and flavored little cigars. And again, it's only in African American communities, only in low income communities. And that's where the targeting started. That's how it started. And then you look at our magazines, the African American focused magazines, Jet, Ebony.
Mhm.
You couldn't flip 3 or 4 pages before you saw a ad for a menthol flavored cigarette. You look at even today, to this day, the Cool Jazz Festival. It's not cool as in hip. It's cool as in cool, the
Cool.
menthol brand cigarette.
Mm.
And we look at how Big Tobacco has funded some of the most influential African American organizations. Now, a lot of them don't take money anymore. The NAACP, the Urban League, they don't take tobacco money anymore. But years ago they did, because Big Tobacco was like, you scratch our back, we'll scratch yours. And that's the nature of how Big Tobacco works, is to come across as, hey, we're doing something good for the African American community, when the reality of it is they're contributing to the death of the African American community with their products.
So, but what would you say to that person who will push back on that and say, well, you're a human being, you have free will, you have a personal responsibility. You had mentioned health equity and the systems and how they can kind of act to influence and oppress. But what would you say to the person who says, well, you have a personal responsibility, you can quit smoking, you can do it, how come you aren't? What would you say to that person?
Well, one, yes, you can quit, but and some people can't just quit. But what we have to realize is that nicotine is a drug, it's an addiction, and that would be akin to saying someone that's addicted to heroin or cocaine, hey, you can quit. And then let's take a step further and look at the opioid addiction. Hey, you can just quit. When the opioid addiction became an issue in outside of poor, brown, Black communities, then it became a national issue. So in the similar vein with tobacco use, menthol, it's an addiction that's strong as, if not stronger than a narcotics addiction or an alcohol addiction, but it's normalized. It's not talked about as an addiction, it's talked about as a bad habit. And then when we talk about, well, we have a personal choice. If I want to smoke menthol, that's my choice. Is it? Is it really? Because we know that, again, it wasn't always like that. It's because of how it was strategically targeted, placed in our communities, made available in our communities, that it got to where it is today. So that choice that folks think they have in choosing menthol started as a, again, this insidious plot plan, this measured attempt, not even attempt, this measured behavior that put it there. And then we saw those levels of menthol use rise, and now it's again normalized. So it's like, that's just the cigarette that Black people like. You know, it's not. It was made. We were made to like menthol cigarettes. It's not that there's just this natural affinity to menthol.
When you talked about the Jets and the Ebonies and all that, also, we all know those ads and that marketing is all about, how cool somebody is, the man, the woman's looking, beautiful, the man's looking all, cool and dapper and things of that nature. And when you talk about the insidious nature of it, the challenge there, and you've heard me say this before, Michael, when we were talking, and Takum, you've heard me say this recently, the real crazy thing about that is, if you're pumping that into these magazines that our community consumed, a lot of time they're through agencies, right? Through marketing groups that were and are, African-American also, right? So it's a challenge because on one end, that's revenue for an agency. So they're doing well for their community and economic development. But at the same time, it's a product that's obviously doing great harm to our community and for, years and years and decades to come, especially with these younger generations.
And it impacts folks that don't even use the product, So we think about exposure to secondhand smoke, thirdhand smoke, looking at the levels of asthma in African American kids. There's a connection between that and secondhand smoke. So here we have a product that not only kills the user, but it can kill folks that don't even use the product.
Wow. I remember you referenced that related to cancer, certain cancers. You said even with secondhand smoke. I mean, these, individuals can be, just greatly affected, and they're not even, like you said, a primary user of the tobacco use. Wow. Wow.
And then, again, with the equity piece, and all of the other disease states that tobacco use impacts, it's just, it's just when you really think about it, it's amazing that this product still remains on the market. But if we go back to where it all started, and I'm talking about tobacco as a personal use product, as a leisurely use product, we're going back to slavery. And if we're going to take it back that far, we're taking it back to the building of this nation, the creation of this nation's economy. Where did it start? With tobacco as a cash crop. How did tobacco become a cash crop to the level that it was required through free slave labor? So when we look at the economy of this country right now, the creation of that economy is based on slave labor and tobacco.
Wow. Going way back.
Yeah.
Affecting us then, affecting us now. We, July is National Minority Mental Health Awareness Month. Want to make sure we touch on that. Michael, again, I know you all are doing so much work in so many different areas. We've talked even specifically related to tobacco use and mental health and things of that nature, but I just want you to, give you the floor a little bit about, any work currently or future that you all are focusing on related to mental health in our communities.
Yeah. Sure. And just to bring tobacco into it again, when we look at the folks that are, diagnosed with mental health issues. They may be in a facility dealing with mental health or substance abuse. Those folks smoke menthols and smoke at way higher rates
Wow.
than other folks. And even in some places, maybe not anymore, that was the reward for, good behavior, a pack of cigarettes. We're going to take everything else away from you, but we're going to leave you that tobacco. And again, noting that it's, Mental Health Awareness Month. And, when we talk about African Americans in mental health, again, the Center for Black Health and Equity is about health and equity across the board. So we are entering into that mental health space and realizing that there needs to be a discussion, an African American discussion around mental health, just like there is around tobacco use, cancer, HIV, because we're being impacted by, I don't want to say mental health, but maybe the lack of, attention to mental health. So what's causing these mental health issues? Of course, we can talk about COVID and how that's impacted everybody. But when we talk about mental health and how that manifests, and the causes of that, we can look at racism, the stress that's induced by that. We can look at, the current climate. When actually, when we say the current climate around police interactions and police brutality, that climate has been around for us forever.
Indeed.
We've
Indeed.
known about it, but now that it's being televised, now that it's being broadcast, and other folks are saying, "Oh, so yeah, y'all weren't messing, or y'all weren't exaggerating all these years when you were complaining about it," you know, that impacts your mental health too. Because we've been saying this for years, and you didn't believe
Right.
us, and this is what it took for folks to finally make a move and start putting some things in place. Um, so yeah, the mental health aspect of the work we do is definitely on the incline, realizing that one, that there's definitely interconnectedness with tobacco use, with other disease states. That stress is a mental health condition as well, because it's going to impact your ability to perform at work, to relate to your family, to your coworkers,
Yep.
to your friends. And this whole notion of, keeping everything inside and not addressing any feelings or emotions you may be having, as men, and specifically as Black men. I mean,
Right.
I think we're slowly seeing that train of thought go out the window, and we're seeing more acceptance and realization that, hey, if I'm struggling with something, it's okay to talk about it.
Yep.
It's okay to admit that, hey, I'm not okay right now.
Yep. Hopefully eliminating some of these stigmas, like you said,
Mhm.
destigmatizing some of this normalizing,
Right.
The fact that if you need help and that there are resources and relevant resources, relevant sources to reach out to, that like you said, it is okay.
Yeah, and we've got to do something, because when we look at the rates of suicide
Yes.
in Black youth, we're at an all-time high.
Yeah. Yeah. That's something we gotta do a lot of work on. Tacoma and I
Yeah.
talked about that a lot, and doing that work, we need to make sure that these young people know that there is hope and that they can move until tomorrow. We got
Mhm.
a lot of work to do there.
Yeah.
Go ahead,
And
Tacoma.
That's a wonderful segue. Well, not wonderful, but it's a segue nonetheless about some of these particular issues around mental health that we struggle with as a community, especially Black men. Can you talk from your line of work, from your observations, the particular kinds of mental health conditions that impact us?
and I'll speak from just my own personal experience, in feeling the sometimes the level of stress and responsibility, and it may be even so finger pointing that as Black men, I think we probably all experience. Um, and then how does that impact you in your everyday life? Um, Now, when we talk about mental health, I think, well, one, we all know there's a stigma around it, um, but I consider mental health to be your mental health, your emotional health, and like really, there's really not a whole lot of difference between the two. They're so connected. Now there may be a clinical diagnosis of some kind of mental health issue, um, and I think that's where folks kind of their mind goes to. If you're thinking mental health, you're talking like bipolar disorder or some schizophrenia, but it doesn't necessarily have to be that significant of a diagnosis. It doesn't have to be a professionally diagnosed condition to be suffering from a mental health condition. And a mental health condition doesn't necessarily mean it's permanent. It doesn't necessarily mean that that's something that you have to carry with you for the rest of your life. It could be, it could be seasonal. It could be, you know, incident specific, but the overall gist of it is that it's okay to, again, it's okay to not be okay. And the resources that are available for Black men specifically around mental health are probably few and far between, or at least not as available. I think we're starting to see more and more, but not like we are for just other folks in general. So again, equitable policies, equity.
Right.
If we're seeing this increase in mental health issues, we need to see an increase in mental health resources, affordable mental health resources, culturally appropriate mental health resources.
Michael, tell us a little bit about the work that you all are doing. I know you have regional conferences. I know the center has national conferences.
Yes.
Tell us a little about that. Share with our audience the work that you all are doing there, and what's to come in the future, and what's what's the focus when you all have these events and activities.
Sure. So our keystone event, our national event, is the State of Black Health conference. And we started that conference, the initial conference was in 2018. And this is, and really, just like it says, it's the state of Black health. And when we say the state of Black health, we're talking about health, physical health, mental health, economical health, just across the board. And who this conference is for everybody. So organizations are invited, community-based organizations, professional organizations, faith-based institutions, individuals, youth groups, and the sessions, the breakout sessions, the keynote addresses, really they address all aspects of African American health. So we're going to have cancer specific topics, conversations. We're going to have mental health conversations. We're going to have conversations on, economic development or the lack thereof. And we do that every 2 years. So of course, COVID put a stop to that. We did it virtually in 2020. The next one is coming up in December 2023 or December 2023. We'll be having our next State of Black Health conference, which will actually be in San Juan, Puerto Rico.
Puerto Rico. Oh,
right. So we do that biannually. And then in between, we do a regional State of Black Health. The very first one was in New Orleans. Again, the second one was online or was virtual. This year, we will be doing it in Oakland, California. And actually, let me roll back. The regional State of Black Health will be in December of 2022. So this December.
Got it.
The State of Black Health will be in September 2023.
23. Got it.
So folks have time to prepare and well, we don't need passports to go to Puerto Rico. But and of course, all this information will be on our website, and we'll stay in touch. And as we get closer, and the save the dates and the flyers come out, we'll share that with you all as well. But the regional State of Black Health, similar to the national one, where with the exception that it's going to be focused, maybe on some regional issues. So the folks that are invited to State of Black Health National, they're going to be from everywhere. The regional State of Black Health will try to get folks from that region. So it's going to be in Oakland this year. We'll have a lot of folks from the West Coast, from the Midwest, and focus on some of the health issues, some of the social concerns that are going on in that area of the country.
Got it.
No Menthol Sunday is another one of our national events, and we've seen a lot of traction, a lot of movement in No Menthol Sunday, and that event came about. It's in the same vein as the Great American Smokeout, where the focus is that we're getting the information about menthol flavored tobacco use to African American communities via faith-based institutions. So from the pulpit, from that trusted source in the African American community. And we've expanded it to include HBCUs, health departments, any organization that wants to participate. So even though it's still No Menthol Sunday, it's not strictly faith-based at this point, because we want whoever wants to join the fight, whoever wants to be educated, whoever wants to build their capacity and their knowledge around why this product and how this product impacts our community, we encourage that. And it's international at this point.
Okay.
We've had participation from folks in South Africa. Because when we
Awesome.
talk about menthol, it's not just here in the States.
Right.
It's impacting the world as well, and even mainly Black folks, mainly brown folks. So those are a couple of our national efforts.
Well, good. Well, listen, as Takuma always provides, we want to, open up just as we close, give you an opportunity. Anything you want to share that we didn't touch on? You got so much to talk about with the center. I'm sure we're going to figure out a way to continue to connect and talk more. Takuma and I talked a lot even about HIV/AIDS. We have a foremost expert we've brought on before, so I would love to dive into that more with you. But anything you want to close with, Michael?
Sure. I'll close with this, and we it's close to the deadline, but in reference to the FDA ruling, the banning of menthol, the banning of flavored cigars, they are taking public comments. So when something like this becomes, a piece of a law that is going to happen from the FDA, they request comments from who it's going to impact. So the public, so individuals, organizations are encouraged to go to the FDA website, and we have a link to it on our website for if folks can't maneuver their way to it, centerforblackhealth.org. And then from there, it'll be easy to find. But we encourage folks to go on there and make a comment to support the banning of menthol, to support the banning of flavored cigars, and to also encourage additional components to these rules. There needs to be increased cessation resources and efforts. There needs to be more inclusion of products. So they should include e-products. They should include all cigars. They should give us a definition of what is a what makes it a characterizing flavor. And once the rule is put in place, give it a start date. Don't, as it stands right now, once the rule is put in place, they're saying retailers will have a year to go into effect to pull the products off the shelf. So it's a whole year of still providing that product. We look at other products that this has happened to, and they're taken off the shelves immediately. For folks that aren't aware, Juul, the most popular e-cigarette ever, they finally took it off the market. And the announcement just happened a few weeks ago. The announcement happened on a Thursday, I think. And on Friday, those products were off the shelves, or were supposed to be off the shelves. So why not do the same for menthol? If you're going to say the drop dead date that this goes into effect is September 1st, September 2nd, we shouldn't see those products.
Right, pull them.
Don't give folks a whole year to continue to use the products and be exposed to all those negative impacts related to it.
Yeah. Well, hey, thank you, Michael. We appreciate you coming on. Again, we're here speaking about Black Health and Equity. Michael Scott, Senior Program Manager with the Center for Black Health and Equity. Again, you can find out more information about the center at centerforblackhealth.org. That's centerforblackhealth.org. We'll make sure we stay in touch, brother, and we'll have some more of these discussions. All right.
For sure. Thank
you.
Grateful for your time, brother.
Anytime, man. Anytime.
Respect.